Well, hey everyone, welcome again to one of our live sessions. Last time, the session that we had was about skin health. This time, we have a very interesting topic to discuss. And while we are discussing this topic, this is the most common queries are something that we are going to discuss in this topic. Um, this topic is going to be about hair fall. Why do we get hair fall? What is the common age that we see the hair fall in? Is hair regrowth possible? What are the factors that are influencing the hair fall? And what are the factors that hindering the absorption of nutrients? Are there any lifestyle factors that we need to take care of? So these are some of the topics that we are going to be discussing. There's also going to be talked a lot about what kind of nutrition do you take for controlling your hair fall or taking care of your hair health. So, speaking about nutrition, let me give you a quick introduction for myself while people are joining in. I am Shraddha Khanna. People who had attended the Skin Health live session last time might know that I'm a nutritionist by profession, having 9+ years of experience in the field. So, we are going to be having a very great subject matter expert with us today, a very special guest to us, also very influential on social media. You must all have watched his videos. So let me just invite Dr. Agni, who's the subject matter expert. Hi
Hello.
everyone.
Hi. Hi, how
Oh,
are
well,
you?
hello. Hi. What's
All
up? How
good.
are you? I'm good. How are
Is my
you?
voice reverb? Yeah, is my voice re
Am I
reverberating?
audible?
There's no
Yeah,
echo. There's no echo, right?
yes, it's fine. It's
Okay,
fine. No,
perfect.
there's no echoing. It's all good. Amazing. So, Dr. Agni, welcome to our Instagram
Okay. Thank
live
you.
session today. And like you know, you're the subject matter expert, and we're going to talk about the most commonly talked
Okay.
about subject, which is hair fall. So, while we have a chat about this today, I hope everyone over here gets some tips down. And end of the session, they should be able to handle their, hair fall, or in fact manage the hair fall. So there's gonna be a lot of myths around. There are a lot of myths around hair regrowth when it comes to hair fall. What are the things that needs to be taken care of? I think with your expertise and mine, we'd be able to craft something
Dr.
beautiful for
Agni.
the audience out
Okay,
here.
I think your expertise more because since we're talking more about you're the nutrition expert, I'm gonna okay, our friend Dr. Siddhant Bhargava, Dr. Agni's hair is perfect. Thank you. Thank you so much. Okay. So
Amazing.
when we speak about please after you.
So yes, but before we start, I'd like you to introduce yourself in a brief manner to everyone around here. People, all of them know you, but still, a quick
Okay.
introduction
Hi,
would be,
everyone.
amazing.
My name is Dr. Agni, and I'm a dermatologist. And today we're going to be speaking about hair fall, which is something which plagues everyone. Even if, let me just say, even if a dermat didn't know anything, but they wanted to know how to treat hair, their practice would flourish. That's how severe the problem is. So that's what we'll be talking about. And
That's true.
hopefully, you guys can take something back. Um, think of it like a mini one-on-one, but करते हैं. We'll figure something out. कुछ तो सिखा के जाएंगे.
We'll
And by
figure
the end of
something
this
out.
conversation, I think everyone who's listening will know कि hair fall क्यों होता है, how do we prevent it, and how can we possibly fix it. Okay, so I promise you this is going to be
Fix it,
fun.
yeah.
If you're doing something, सब छोड़ दो, सब बंद कर दो. Stay 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 glued to your screens. We're going to have some fun now. Okay, Shudha. Yeah.
Amazing. So, well, before we start talking about why hair fall and what are the causes, what are the symptoms, and how can you fix it, I'd like to talk a little
Hmm.
about the hair structure. Although you're the subject matter expert, but I talk to you in a very layman language, how I understand hair as. Uh, there's a tree. it has roots. Similarly, you have the
Hmm.
structure of your hair exactly looks like a tree. It has roots to it. So correct me if I'm wrong. Uh, whatever, whenever a tree grows or however a tree looks, it all depends upon what kind of how
Yeah.
strong is the root, right? How strong is the root? How nourished is the root? So can I say that everything that's given to the root decides the health of the tree? And when it comes to
Yeah.
hair,
Yeah.
is the root of the tree, it's exactly the hair root is
Yeah.
basically called the
No, no,
follicle,
no, no, no. Very,
right?
very.
If I'm wrong, please correct me. But is it that place where you get the exact where what basically whatever depends whatever health of your hair is dependent on is on the
Yeah.
follicle.
So
am i
perfect.
am
This
i
is a
right
very
or am
good
I wrong?
example of the hair being like a plant. So for everyone who doesn't know or who's new to this, um, your hair is there is a seed. Okay, on my palms there are no seeds. So मैं जितना भी यहाँ पे हेयर फॉल का ट्रीटमेंट कर लूंगा यहाँ पे कभी बाल नहीं उगेगा by no stretch of imagination. Okay, I have no seeds here. I have no seeds
Right.
here. So I can put all the PRP here. I can apply all the hair products. I can apply all the hair serums on my palms, and I will never ever get any hair growth. Okay. So wherever the seed
Correct.
is, wherever the hair follicle is, udhar hi we can salvage hair, udhar hi we can grow hair. So now how the hair functions is कि people when we speak about hair, one thing that I think everyone should know is that सबका जो hair का length होता है ना, that is decided by your genetics. So today only itself, I got a patient. She was about, I think she was a 18-year-old girl. She had hair till here, and
Mm-hmm.
she's like, sir, मेरा hair growth ही नहीं होता है. And I'm
Okay.
like, और कितना लंबा बाल चाहिए तुम्हें? You know, your hair is still here. But that's because that's how her hair is. Her hair is genetically like that. So everyone has a genetic structure. Now I happen to have a beard which is covering my entire cheek. There are certain men उनका पूरा patchy beard आता है.
Correct.
They're unable to get proper beard, right? And for those men, you can put all the hair growth serums, but अगर उनको वहां पे hair follicle ही नहीं है तो कभी भी दाढ़ी नहीं आएगा. So do not waste your money. Do not waste your time by running after these unthinkable treatments which do not exist. So जहां पे आपका हेयर का फॉलिकल है, जहां पे आपका हेयर का सीड है, उधर ही हेयर फॉल होगा और उधर ही हम हेयर को बचा सकते हैं. The corollary is, imagine you have a very, very, very
Right.
bald person, okay? Someone like a Rakesh Roshan or anyone. That's the first person which comes to my mind. Or if anyone, if they were fans of roadies while
Okay.
growing up, hi Chandni. If anyone was a fan of roadies while growing up, then you know that Raghu and Rajiv and all. So those are absolutely bald men, okay? What does that mean? That their scalp has no follicles. उनके scalp में hair का कोई seed है ही नहीं.
Correct.
So again, now if Raghu and Rajiv from Roadies tomorrow they start putting all hair products, they start eating all the supplements, they can do whatever they want to. एक भी बाल नहीं उगेगा. Okay, so that is something that you need to be aware of and be aware of that if a doctor is going to offer you 100% result, boss, हमसे तो आज तक नहीं हुआ. It's not possible. So yeah.
So I think when it comes to what I'm understanding is whenever it comes to so first of all, can you tell us
Yeah.
whether hair regrowth is possible? Yeah, I understand if you don't have follicle, that's a different
Okay.
case. But for people who
Understood.
do
Understood.
have, is
So
hair regrowth
primarily,
possible?
what
Yeah.
greater than 90% of the people who suffer from hair fall, उनको दो ही बीमारियां होती हैं. Okay, one is called androgenetic alopecia, जिसको मेल पैटर्न हेयर लॉस बोलते
Hmm.
हैं, फीमेल पैटर्न हेयर लॉस बोलते हैं. मेल पैटर्न हेयर लॉस में कैसे दिखता
Correct.
है? My hairline will start receding. Okay, मेरे यहाँ से बाल का डेंसिटी कम हो जाएगा. Okay, एंड इधर से
Hmm.
द स्कैल्प एरिया, द वर्टेक्स एरिया, यहाँ से भी हेयर का डेंसिटी कम हो जाएगा. सो दिस इज क्लासिक मेल पैटर्न हेयर लॉस. ओके, फीमेल पैटर्न हेयर लॉस कैसा
Right.
रहता है? इफ यू लुक एट अ फीमेल,
Right.
इफ यू लुक एट द सेंटर पार्टिंग, व्हेन दे डू अ मिडिल पार्टिंग, you'll see that मिडिल पार्टिंग ज्यादा वाइड हो गया है. इन फीमेल्स यू कैन सी मोर ऑफ द स्कैल्प. ठीक है. सो दिस इज द डिफरेंस बिटवीन मेल पैटर्न एंड फीमेल पैटर्न हेयर लॉस, वन ऑफ द मोस्ट कॉमन कॉजेज ऑफ हेयर लॉस. ठीक है. दी अदर कॉज ऑफ हेयर लॉस है जिसमें एक्चुअली हेयर फॉल होता है. ओके, उसमें आप बोलोगे कि डॉक्टर मैं कंघी करती हूँ एंड माई हेयर हाथ में आ रहे हैं. ओके, और आई एम हैविंग अ बाथ एंड आई एम शैम्पूइंग माई हेयर और हेयर
Hmm.
मेरे हाथ में आ रहे हैं. ओके, सो दीज आर टू डिफरेंट सिनारियोज बट दे वेरी सिमिलर. फर्स्ट सिनारियो में अगर मेरा हेयर लाइन रिसीड कर गया है, ओके, आई हैव बिकम Anupam Kher, I have become Rakesh Roshan, I have become Raghu Raji, whatever. मेरा hairline इतना recede हो गया है कि अभी hair growth नहीं हो सकता, right? There is
Hmm.
irreversible hair fall. The other
Correct.
situation where someone is
Right.
just complaining of, मैं बहुत stress हो, my diet is not good, my sleep is not good, I'm getting active hair fall, I'm combing my hair, I'm getting hair fall, I'm just wetting my hair, I'm getting hair fall. In that, your hair density is reducing, but your hair line, everything, your hair follicles, everything is intact. These are the patients in which we can achieve
Correct.
beautiful result because ये अच्छे से regrow कर जाएगा. Seed वैसे का वैसा ही है, बस fall कर गया है, right?
Correct.
The first group where male pattern hair
हाँ जी.
loss, female pattern hair loss, in these people, if you do not start treatment early, taklapan. So that is something that we need to look out for.
Yep. Yeah, exactly. And I think when it also comes to genetical, factors, or if we say about the genes, right? There are a lot of people who have genes in the family, like they have baldness in the family, they have hair fall, or no hair regrowth in the family. But I feel you would be the right person to tell this right now. When there was a time when we used to speak to the clients and they used to tell us, if you ask your dadaji and your nannies what age did you start seeing the baldness or the hair fall, they would say
Mm.
40s and 50s, right? But now when I speak to the clients that I attend to, they're like an average of 25 and 27 years old coming up with complaints like, I can see this because
True.
it's genetic in my family. But what I think they need to understand is, when you're below 45 years of age, the chances of reversing something is much faster and much easier versus when you reach that age. The tendency of your hair follicle to show the to get the nourishment and to absorb it is better when you are in that age versus the other age. Similarly, there are other factors apart from genes. There's age, there's digestion, there could be the lifestyle.
So,
So a lot of things. What's your take
as a
on
lot
this?
of our patients tell me, काफी कॉमन चीज है कि मेरे दादा मेरे नाना उनके बाल तो बहुत लेट झड़ने लगे, ओल्ड एज के रिलेटेड हेयर लॉस हुआ है, एंड पीपल कंप्लेन दैट yes, my
हाँ.
grandparents, my father started losing hair at the age of 50. Okay, why am I losing hair at the age of
Yeah.
20, 25? Okay, number one, ये एक तो आपके genetics में है, family history positive है. Okay, now when we say family history, I
Hmm.
don't just mean आपके पापा, आपके दादा, आपके नाना. I also mean hi warrior, hi. I also mean your uncles, your aunts, everyone. Okay, so if there is family history of baldness, if there's family history of hair fall, first of all, you have the genes. Couple that with आपका बहुत stress ले रहे हो, you're not sleeping properly, you are not exercising properly, your diet is not good, you're not sleeping properly, you're smoking, you're drinking, and any other drug that you could possibly do. I do not know what you do. So when you couple that, your genetics, bad genetics, with lifestyle, that is when you start noticing very early hair fall. And that is why today I get
Yeah.
patients at the age of 18, 19, 20 जिनका hair fall start हो जाता है, even though उनके parents का hair fall around the age of 40, 50 start हुआ था. Number one. Now, Parul Sharma, Dr. Agni, please say my name once. Hi, Parul. And the other thing what you said is, if someone tackles hair fall earlier, the results, I'm your biggest fan. Wow.
Yeah.
If someone tackles hair fall earlier, the results will show better. And if you delay, तो बात खत्म होगी ना. फिर जब कुछ बाल ही
बात
खत्म
खत्म
होगी
हो
तो
गई
बात ही
आपकी.
खत्म होगी. Bad joke. Okay.
Yeah. Okay. Correct. That's put rightly. And I also feel that nutrition, like I'm gonna be talking about nutrition because I'm a nutritionist by profession. So I'd be saying that nutrition plays a very important role. Like you said, if your lifestyle is bad, if you're a smoker, you're gonna be definitely deficient in vitamin C and vitamin D, which is something that every smoker is deficient in. So that needs to be, and in such cases, when you see there's a deficiency coming into the picture, there's supplementation which comes into the picture, which is more important from your diet, and if you need it, from the supplements. So I when I talk about nutrition, I also feel there are a lot of nutrients which are very much important for your hair fall control or for helping you regrow the hair. So, but I'd like to know your intake,
Okay,
I
so
mean, your input first. And
okay, so
intake actually.
nutrition is.
Because you have good hair, so your
You
intake
think I have
and
good
your
hair?
input both.
Oh, thank you, yaar.
Yeah, yeah, I
Thank you.
think so.
Not bad.
That's not
Oh,
bad.
oh, hello. Oh, oh. Not bad क्या होता है? हाँ?
people are gonna people are gonna unsubscribe immediately to Wellbeing Nutrition. I can't say that. No, I love your hair,
Oh,
so
thanks, yaar.
please go
So,
ahead.
okay. So nutrition is super important. You spoke about smoking. That's very, very keep in mind that your skin and your hair, your body does not care about it. Okay? If my nutrition is low,
Yeah,
my body will always try and preserve my heart, my brain and my kidneys. Okay? अगर मैं महीने में 100 रुपए कमाता हूँ,
right.
तो then in that I would rather that I eat मैं अपना पैसा मैं किस पे खर्चा करूंगा? खाने पे खर्चा करूंगा. मैं अपना पैसा I will spend money on getting a roof above my head. Okay? These are your basic necessities. So you having your
Right.
brain, your heart and your kidneys, when your resources are limited, your body will divert everything to these organs. It does not care about your skin and hair. Your skin and hair will only flourish, वो तभी अच्छे
Right.
होंगे अगर आपका न्यूट्रिशन एक्सेस में है. Okay? So your skin and hair is a luxury protein. So only when your protein is good, only when your multivitamin intake is good, only when all your micronutrient intake is good, only when your antioxidant intake is good, when all your trace minerals, बेसिकली जो आपके टीचर आपको स्कूल में बताती थी एंड जो आपकी मम्मी आपको बचपन में बोलती थी, बेसिकली इफ यू ईट ऑल ऑफ दैट, यू ईट अ बैलेंस डाइट, इट इंश्योर्स दैट all your nutrition is proper and your hair will grow properly. So a good head of hair is actually a sign of good
Correct.
nutrition. People who undergo ऐसा डाइटिंग कर रहे हैं, क्रैश डाइट कर रहे हैं, मुझे 25 दिन में शादी है, मुझे 5 kg कम करना है, people, what nonsense people do, in stuff like that. The first thing you notice is your skin
Yeah,
becomes एकदम dull, skin में जान ही नहीं रहती, your hair starts falling, so
yeah.
thinning and falling.
Hair starts
Okay,
thinning
so
also.
this is
Yeah.
the importance of nutrition. And unfortunately in today's day and age, हम लोग उतना अच्छा डाइट किसी का भी नहीं है. Okay, the kind of vegetables that we eat are not as nutritious as what our grandparents used to eat. They're riddled with insecticides, pesticides, soil की quality ही कम है. So the kind of nutrition that we are getting from our food is not as good as what we have wanted it to be. So in that case, अगर आपका diet अच्छा नहीं है, you have no option but to go for supplements. So thing is, I try and eat
Correct.
a healthy diet, but of course नहीं हो पाता. So I take supplements every day. And the thing with supplements is, they are water soluble, which means उसका side effect per se नहीं होता. You drink a lot of water and all your multivitamins, vitamin B, C, ये सब flush out हो जाता है. Okay, there are certain supplements that you need to be very careful about. They are like your vitamin D. Okay, तो लोग vitamin D लेते हैं, vitamin A लेते हैं, vitamin E लेते हैं. With these three vitamins, you have to be very, very simple. You have to be very, very careful because इसमें toxicity होने का chance बढ़ जाता है. आपका overdose होने का chance बढ़ जाता है if you do not take it
Correct.
properly under the guidance of a doctor. But for every other vitamin, every other
Yeah.
supplement, they're all super safe. So I take supplements every day because, see, at the end of the day, no one will trust a dermatologist properly अगर खुद उसके बाल अच्छे नहीं हैं, right? और या खुद no one will take me for skincare advice if I have lots of pimples or whatever. So it's important that you get all your vitamins, you get all your supplements. So I take supplements. I'm a firm believer in supplements because supplement का मतलब क्या होता है? That it is supplementing.
Exactly.
मेरा नॉर्मल डाइट उतना अच्छा नहीं हो पा रहा तो मुझे सप्लीमेंट करना पड़ रहा है. इट इज नॉट अ रिप्लेसमेंट, इट इज अ सप्लीमेंट. सो ये एक चीज बहुत जरूरी है.
Yeah, what people don't understand is supplements have to complement your diet, not replace it. That's one thing which people think that, okay, supplements is gonna do wonders. I don't have to correct my diet. I don't have to correct my lifestyle. If I take this supplement, oh my God, I'm gonna see no hair fall in the next 1 week after consuming the supplement. No, supplements don't work like that. Supplements work when you they basically support the effort that you put in correcting in
Yeah,
your
yeah.
diet and your
And
exercise and your
supplements will
lifestyle.
only work अगर उधर आपका बीज है, अगर उधर आपका सीड है, अगर उधर आपका हेयर फॉलिकल है. If your hair follicle doesn't exist, You may have all the minoxidil in the world, you may have all the finasteride in the world, you may have all the supplements in the world, biotin, have whatever. If the hair follicle doesn't exist, you will never ever get hair growth. Okay, so it's very important that I tell you this because I don't
Correct.
want my audience to unnecessarily waste their money on something जहाँ पे result कभी नहीं आएगा. Okay, so tomorrow if Anupam Kher decides कि अब मुझे hair fall हो रहा है बहुत, अब मुझे सप्लीमेंट खाना चाहिए, मेरे बाल उग जाएंगे, बंदे के नहीं उगेंगे. He is a complete, he's like an एकदम completely bald head of hair. So in that situation supplements will not help. So हम जो भी hair के लिए treatment करते हैं, whether I'm doing a PRP, whether I'm doing your minoxidil, I'm giving you hair serums, I'm giving you hair supplements, all this will only work if you have hair. अगर आपका hair ही चला गया तो बात खत्म.
Yeah, exactly. And also, like he said, the internal nutrition is quite important for the hair follicle to, act positively for you. And if you don't have that internal nutrition, I don't think it's going to help. There are a lot of questions coming up with what kind of supplements, which are the nutrients we should be taking.
Yeah,
So
let's take some
I'd like to address
questions.
few
Yeah.
of them. Uh, yeah, I think so. And what happens here is while we focus on biotin is one supplement that you should be definitely taking, but there are a lot of other ingredients. It also depends on what kind of health concerns you have. What is the root cause of your hair fall? It could be that uh, you're someone who is experiencing hypothyroidism. There could be a deficiency of vitamin D because you don't have thyroid hormone built there. There could be a deficiency of iron. So these are the important supplements for someone who has thyroid. Someone who has another nutritional deficiency, like how we spoke about smokers, would have to consume combined biotin with vitamin C, because that's going to be the main cause of building the stressor in the body, which could also be a reason of hair fall. If you have like too much of free radicals in your body, these stressing components are gonna also create an oxidative environment in your body where the hair fall
Yeah.
will start happening after the hair starts thinning. So these are some supplements. Omega-3 is something that y'all can definitely look at. Not only does it cures or maybe help you with the inflammation, lowering down the inflammation in the body, but that is also something which provides you the nourishing fatty acids that your hair needs for it to coat it, to protect it from any damage that happens externally, because obviously your hair health is dependent on external conditions and internal conditions. There might be a lot of them using
Yeah.
styling products and
Yeah.
doing all sorts of hairstyling,
Yeah.
which might also damage the hair.
So
So
supplements that I would
there you
recommend
could
for hair
also.
health. Okay. One of the questions that I keep seeing is about early graying of hair, white hair. उसके लिए कौन सा vitamin लेना चाहिए? So I'm going to tell you this. For someone who has early graying of hair, फर्स्ट देखो कि आपके पेरेंट्स के हेयर कितने जल्दी ग्रे होना स्टार्ट हुए थे. इफ योर पेरेंट्स हैड स्टार्टेड सीइंग अर्ली ग्रेइंग ऑफ हेयर, इट्स वेरी हाई पॉसिबिलिटी कि आपके भी बाल जल्दी ग्रे हो जाएंगे. इन दैट केस व्हाट आई वुड रेकमेंड इज vitamin B5, okay, calcium pantothenate. So vitamin B5 is what we usually prescribe for early graying of hair, along with all your antioxidants. So you spoke about omega 369. Omega 369 is a very
Right.
good antioxidant. You spoke about vitamin C. Vitamin C is a very good antioxidant. But for early graying of hair, the most important vitamin that you can take is vitamin B5 or pantothenic acid. Okay. Now, अगर आपके
Correct.
पेरेंट्स के बाल जल्दी सफेद हुए थे, आपकी भी जल्दी सफेद हो गए हैं, प्लीज टेक B5. बट what I will recommend to you is please you have to color your hair, because you cannot reverse something which has already become gray. जो चीज सफेद हो गई है आप उसको रिवर्स नहीं कर सकते. You will be considered very lucky, and I tell all my patients this. अगर आपके ऑलरेडी बाल जो ग्रे हो गए हैं, अगर वो ब्लैक हो गए, consider yourself very lucky. What we can do is we can prevent your other hair from becoming gray. Okay, so that's where all your pantothenate and all vitamin B5 come into the picture. But जो आपके बाल already gray हो गए हैं, I would definitely recommend that you please color your hair, you gray your hair. I mean, you put brown or black, whatever color you want, if you feel conscious. Okay. The other, you spoke about biotin. So biotin is again very important. Now for someone whose biotin is something जो by and large हमारे food में आ ही जाता है, right? You get it in you get it in your nuts, you get it in bran, you get it in a lot of other things. By chance आपका nutrition proper नहीं है, सिर्फ isolated biotin deficiency नहीं होगी, you'll also have a lot of other deficiencies. So you have to correct biotin, of course, but at the same time you also have to correct the other deficiencies. नहीं तो कल को क्या बोलोगे, बायोटिन लिया लेकिन हेयर फॉल ठीक नहीं हुआ. अरे बिकॉज सिर्फ बायोटिन आपका कॉज नहीं था, आपका विटामिन डी भी लो था, आपका विटामिन के भी लो था,
Correct.
राइट? सो व्हेन यू एक्चुअली
Correct.
सीइंग मैसिव हेयर फॉल, यू हैव टू करेक्ट ऑल द मल्टीविटामिन. सो बायोटिन को लेना पड़ेगा, उसके साथ और भी चीजें लेनी पड़ेंगी. So you cannot be just treating one thing and then expecting कि बाकी सब everything will fall in place. So this is something which is very important.
Correct.
So
Correct. And also just to interrupt here and just to add an input here, I've seen a lot of them consuming higher dosage of biotin, like that's the
yeah,
only
so
treatment
biotin
for
is not, yeah,
hair fall.
correct.
But what happens, but what happens here is when you have, although it's a water soluble vitamin, it will be flushed out from your body. But if you have excess of biotin in your body, the nutrient which you mentioned, B5, it becomes deficient if you consume excess of biotin. So that's one input that I'd like to add. So you don't have to consume anything in extra dosages. You just have to consume it in a dose which would not cause any deficiency, which is the recommended dietary allowances. So when you look for the supplements, you don't
True.
have to look for higher dosages. You have to look for a normal
True.
RDA dosage because you don't want to fall
Barabar.
short on other nutrients.
Barabar. So basically, so when you take supplements, you have to first of all balance out all the supplements. So just taking vitamin B5 for your graying of hair will not help if the other factors are not corrected. आपको antioxidant भी लेना पड़ेगा. If you're
Correct.
smoking, your friends are smoking, you have to fix that. You have to decrease your stress. There's so many things that can cause early graying of hair. The classic example that I give all my patients कि आपके बाल जल्दी सफेद क्यों हो रहे हैं, that I give them the example of Virat Kohli and MS Dhoni. Okay, Virat Kohli, MS Dhoni, they are our fittest athletes, super fit. Kohli तो vegan है, favorite vegetarian, doesn't drink, doesn't smoke, super athletic, very very fit. When he joined as the Indian team captain, his beard became white because of so much stress, right? So that is the importance of all his diet. Everything is proper, but that is the power of stress. Stress can really screw your head. Hi Manan, hi Devanshu. Stress can really screw your head. Okay, so please keep in mind that सिर्फ विटामिन सप्लीमेंट्स तो लेना जरूरी है, बट सिर्फ उसको लेने से फायदा नहीं होगा अगर आप बाकी चीजें ध्यान नहीं दे रहे. यहाँ पे मैं सिगरेट पी रहा हूँ, यहाँ पे मैं बायोटिन ले रहा हूँ. No, that's not going to cure my hair fall, that's not going to help it. So you have to,
exactly. It's not a magic pill.
Yeah. So that's about it. I think let's take one last question, then we'll wind up. Hi Deva.
Yeah, correct. Also, one more input before we take the last question. People who see hair thinning and also are looking towards strengthening their hair, because there were some questions out there. One nutrient that you can, because your hair is all about protein, so you can add something like a collagen into your supplement routine, or you can also add a regular protein. Make sure that your diet has enough protein before you supplement it, because obviously your diet needs to be corrected first, like I said, but you can always take help of a protein supplement if you think that this is a challenge for you to add into your diet. So that's one. But let's take some questions out there. Okay.
While you search for the questions, आप search करो, because if I search, मेरा chat ही बंद हो जाएगा. The live session, so you will have to scroll.
No problem.
I'll give me 5 seconds. आप just search कीजिए. Let me just answer something. You keep searching. आपको अच्छा मिलेगा तो बताइए. Yes, progesterone. So any hormonal pill, someone asked about a progesterone pill. Any hormonal pill can cause hair fall. Any thyroid abnormality can cause hair fall. Stress can cause hair fall. Dandruff because of excessive scratching can cause hair fall. So all your questions that you've asked me, all the factors that can I reverse hair graying? No, you cannot reverse graying. You can prevent your other hair from graying. Okay. So जितने भी आप लोगों ने questions पूछे हैं, whatever questions you asked, yes, that is the cause for your hair fall. Okay. उसके वजह से आपका hair fall हो रहा है. That's the very fact you even chose to ask me that. Okay. And for everyone who feels that can I where to consult you in person, whatever, just send me an email and we'll figure out a consultation. I'm unable to give you a consult over a live session, but just email me and we'll figure it out. Until then, you tell me the question.
There's a question that says, what supplements would you suggest for 25 years of age
Again, now,
for hair fall?
now, now,
I'm a,
okay.
I'm,
Now,
I smoke
ये
regularly.
एक
Yeah.
okay. So when you come to a doctor for consultation, मैं आपका proper history लूंगा. मुझे आपको देखना पड़ेगा. I'll have to see what kind of hair fall you have.
हाँ जी,
So when someone says I'm a
हाँ जी.
25-year-old person, I smoke and I have hair fall, I cannot help you. I have to see you first. I have to assess you, right? I can just tell you over the see something जो
Yeah.
आपको over the counter मिल जाता है. You don't need a doctor's prescription for that. So supplements are something you're more than welcome to go and purchase, right? But if the cause of your hair fall is male pattern hair loss, then in that I have to start treatment for you. I have to start like a minoxidil. I have to start something like a PRP. Maybe I might have to start a finasteride. So I do not know what you have. So when someone asks you a question like that, मुझे इतने साल का हूँ, मुझे हेयर झड़ रहा है, बॉस आई कैन नॉट हेल्प यू. आई हैव टू सी यू फर्स्ट. आई हैव टू एग्जामिन यू. मुझे आपके स्कैल्प को देखना पड़ेगा. मुझे मेरा मैग्नीफाइंग लेंस लगा के आपके स्कैल्प को देखना पड़ेगा. सो फॉर एनीवन हु हैज सिमिलर क्वेश्चंस, please know that the answer for all will be that I have to first physically examine you. Yeah, something like that.
Assess. Yeah. Because it could be a lot of
कुछ
factors that you might not be
कुछ भी हो सकता
sleeping.
है.
Your digestion is not
Yeah,
good, so it has to be. Yeah, कुछ भी हो सकता है. So it needs to be corrected. It can't be that I have this problem. I'm at this age
yeah.
and
No,
I
but thank you.
need the
Yeah,
hair fall
but
to
I'm glad
stop.
you
It
asked
can't be
because
like
yeah,
that.
I'm glad you
But
asked.
the
You should
question
always
is
ask.
good.
Please never
Yeah.
ever feel shy to ask me a question. I'll try my level best to get back to you. I lag in the getting that part, but just please by all means ask. कोई question बड़ा या छोटा नहीं होता. But I want you to know, for everyone who's listening, that um just writing your symptom and मुझे इसका इलाज बताओ, I cannot help you like that. I will need to see you. I will need to assess you. It's ये मैं chat GPT नहीं हूँ. I will need to see you first. Yeah,
Exactly. Just I think the questions are related to
everything is
the
that. Yeah,
age
everything is
or
that.
the
Yeah, yeah, yeah.
hormonal issue that
Yeah.
they have. Yeah, everything is that. So I'd just like to quickly summarize and ask you one last question. Just to summarize, guys, if you have a internal issue with respect to thyroid, with respect to diabetes, or it's a nutritional deficiency, that needs to be corrected first before going for a treatment or anything, where uh, that should be the first step one. Obviously your age, your genes, everything is going to play, how what lifestyle you have, whether you're doing exercise, whether you're overtraining, whether you're undertraining, everything plays an important role here. So there has to be a holistic approach when it comes to taking care of your hair health. And just to quickly ask you a question, how can I understand, is there a test or something that I can do right away to check what is my hair health, if I had to check it right? Is, I've heard about this hair pulling, that you pull one hair from here, pull one hair from here, and if your hair is thin, if it matches the thickness matches, that tells you at which stage are you, or whether you should consume supplements or not. So what's your take on that?
So I think when
Not
when
at
you
all,
when
right?
you go to your enemies, no, and आप अपने दुश्मन के पास जाओगे और आप बोलोगे कि यार मेरा हेयर फॉल हो रहा है, मुझे बता क्या करना है. आपका दुश्मन यहाँ से बाल खींचेगा, यहाँ से बाल खींचेगा, पता नहीं बॉडी में कहाँ कहाँ से बाल खींचेगा, और फिर बोलेगा देखो आपका तो हेयर फॉल हो रहा है.
So there's this hair,
No,
so I'm
no,
understanding
no.
this
So
hair
no, hair
pulling
pull
test doesn't
test
tell
is
you
a
anything,
medical
right?
term that we do. It's done in a scientific manner. There's a way of doing a hair pull
Right.
test, right? It's very different from
Correct.
जो आपने बताया. I think
Correct.
आपके दुश्मन ने आपको कुछ चूना लगा दिया.
Huh.
So
I've seen a video where I saw that you pull a hair from here and then you pull one hair from the back. So I just thought I should ask.
did you watch a movie? Did you watch the
I
video on
if
plucking
I
or
am
threading or something? हाँ, उसमें definitely बाल कम करने का. अरे I'm kidding यार. I know. Chill. हाँ, हाँ.
was it?
And okay, I'm so I'm so
So
so I'm so
yeah,
I'm
so
so sorry. I'm
there
so sorry. I'm
obviously
cutting
is
you. I'm
a
really
pull
sorry.
test.
For everyone who's asking me, can
Hmm.
you help us with hair routine, this, that, everything? Just go watch my videos. I've tried to make a lot of different videos on hair. क्या क्या करना चाहिए dandruff के लिए, hair fall के लिए, how to oil your hair, hair routine. I've covered them in different videos. Just go check them out. It's not possible for me honestly right now to like tell you like this. Over a
Yeah,
if we have a consult
exactly.
one-on-one, definitely I'll be able to educate you, guide you, treat you. But ऐसे बताना मुश्किल है. So just check out my videos. Cool.
Exactly. Also, we have a team of experts here, so y'all can drop team of nutritionists here. Team of expert, we have Dr. Agni also. So if you have more questions, guys, something which is related to your age, your specific concern, please drop us, DM us on Instagram. We'd be happy to help you in any way we can. Thank you so much, everyone, for watching,
And
and
thank you
thank you
so
so
much. And
much,
by the way,
Doc,
we
for
have
being here.
international people watching
And
this. You know that we have people from other countries watching this. Yeah, there's this
oh,
girl. There's this
I
girl.
don't know.
No, there's this
That's
person. I think she's
amazing.
a girl. She's like, I'm from Pakistan. How do I consult you? Yeah, so we have people. Yeah, it's international.
Ooh,
What?
virtual.
Obviously,
Virtual
yeah.
is best.
Because unfortunately, I can't go there and they can't come here. But just send me an
I
email.
want to mention something.
The
There
people
was
who
a
are from
comment that I
other
saw.
different countries.
Yeah, of course.
So so we get a lot. I get a lot of inquiries from Canada. अरे आज ही कनाडा का वीजा बंद हो गया यार.
There are a lot of them saying that, Doc, you're so cute.
Oh, thank you.
Doc, you're the best. And only
Dubai we can do.
one
Yeah.
person saying, yeah, only one person saying, you both look hot. Thank you.
Okay, wow.
At least there's one comment
I'm
from
from
me.
USA. Okay. So all people from all other countries,
Amazing.
USA, UAE, Uganda. I think he's joking. Pakistan, Canada, all the other countries. Since I can't go there, you guys can't come here. We'll just do a virtual online video consult. Please take Dubai name. I said UAE, United Arab Emirates.
Amazing.
So yeah, just yeah.
Quickly
Let's wind this
winding up
up,
the
guys.
session.
Send me an email and we'll figure.
Thank
Yeah.
you
Yes.
so
Yes,
much.
Shraddha. Yeah.
Thank you so much, everyone, for
Thank
being
you,
here.
Shraddha.
Thank you,
Thank
Agni.
you.
Thank you so much. And thank you, everyone,
Okay,
for
thank you.
watching
See
this.
you.
Thanks for your
See
time.
you. You too.
And
Bye-bye.
have a happy
Bye-bye.
weekend.
Bye-bye.
Thank you. Bye. Yes, bye.